Hi everyone, this is Supriya. Now I'm going to explain you about jaundice. Okay, let us discuss about jaundice. అసలు జాండీస్ అంటే ఏంటో ఎందుకు వస్తుందో అనేది మనం తెలుసుకుందాం. ఓకే, జాండీస్ ఈజ్ ఎ టర్మ్ యూజ్డ్ టు డిస్క్రైబ్ ఏ yellowish tinge to the skin and the whites of the eye. Body fluids may also be yellow. Okay, jaundice is a term used to describe a yellowish tinge to the skin. Okay, and the whites of the eye. స్కిన్ ఐస్ అనేవి yellowish గా అయిపోతుంది అనమాట. Body fluids also may be yellow. Color of the skin and whites of the eyes will vary depending on the levels of bilirubin. Skin ఐస్ వైట్స్ ఆఫ్ ద ఐ అనేది ఎలాగా వేరీ అవుతుందంటే డిపెండింగ్ ఆన్ ద లెవెల్స్ ఆఫ్ bilirubin. ఓకే, bilirubin is a waste material found in blood. Moderate levels leads to yellow color while very high levels will appear బ్రౌన్. ఓకే, జాండీస్ అనేది నార్మల్గా ఉందనుకోండి, అప్పుడు ఎల్లో కలర్లో కనిపిస్తాం. అదే హెవీగా ఉందంటే బ్రౌనిష్గా వచ్చేస్తుంది అనమాట స్కిన్ అనేది. About 60% of all infants born in the United States have jaundice. However, jaundice can happen to people of all ages and is normally the result of an underlying condition. Okay, 60% of all infants ఎవరైతే యునైటెడ్ స్టేట్స్లో పుట్టారో వాళ్ళకి జాండీస్ అనేది ఉందన్నమాట. However, jaundice can happen to people of all ages and is normal the result of an underlying condition. Jaundice normally indicates a problem with the liver or bile duct. Okay, it normally indicates a problem with liver or bile duct. See here, this is healthy skin, healthy person. Affected person చూడండి ఎలా ఉందో జాండీస్. ఐస్ వైట్స్ ఆఫ్ ఐస్ టర్న్ ఎల్లోగా అయిపోతుంది, స్కిన్ కూడా ఎల్లోయిష్గా మారిపోతుంది అనమాట. ఓకే, ఫ్యాక్ట్స్ ఆన్ జాండీస్. Jaundice is caused by buildup of bilirubin, which is a waste material in the blood. Okay, an inflamed liver or obstructed bile duct can lead to jaundice as well as other underlying conditions. Symptoms include a yellow tinge to the skin and whites of the eyes, dark urine and itchiness. Okay, symptoms avannamata. Yellow tinge to the skin, whites of the eyes kuda yellow అయిపోవడం, యూరిన్ అనేది డార్క్ గా ఉండటం, ఇచ్చింగ్ అనేది రావటం అనేది ఉంటుందన్నమాట, ఇచ్నెస్. Diagnosis of jaundice can involve a range of tests. Jaundice is treated by managing the underlying causes. Okay, it is treated by managing the underlying causes. Next, coming to causes. A problem in the liver may cause jaundice. Okay, problem in the liver may cause jaundice. Jaundice is a yellowing of the skin and the whites of the eyes. Jaundice is yellowing of the skin and whites of the eyes. Okay, see here that which here jaundice is a yellowing of the skin and the whites of the eyes that happens when the body does not process bilirubin properly. జాండీస్ అనేది ఎలా ఉంటుందంటే స్కిన్ ఎల్లో అయిపోవడం, ఆ వైట్ ఐస్ అనేవి ఎల్లోగా మారిపోవడం. అది ఎప్పుడు జరుగుతుందంటే బైలిరూబిన్ ప్రాసెస్ అనేది ప్రాపర్గా జరిగినప్పుడు ఈ జాండీస్ అనేది అక్కడ అవుతుంది అనమాట. దిస్ మే బి డ్యూ టు ఎ ప్రాబ్లమ్ ఇన్ ద లివర్. It also known as icterus. Bilirubin is a yellow-colored waste material that remains in the bloodstream after iron is removed from the blood. Okay, iron is removed from the blood. Next, coming to the point, the liver filters waste out from the blood. Okay, here liver filters waste out from the blood. When bilirubin reaches the liver, other chemicals attach to it. Okay, a substance called conjugated bilirubin results. Okay, the liver produces bile and digestive juice. Conjugated bilirubin enters the bile, then it leaves the body. Okay, liver produces bile, which is a digestive juice, and conjugated bilirubin enters the bile, then it leaves the body. It is this type of bilirubin that gives fecus its brown color. If there is too much bilirubin, it can leak into the surrounding tissues. This is known as hyperbilirubinemia, and it causes the yellow colors in the skin. Okay, if there is too much bilirubin, it can leak to the surrounding tissues. This is known as hyperbilirubinemia, and it causes the yellow color in the skin and eyes. Okay, it causes the yellow color in the skin and eyes. Risk factors. Okay, let's discuss about the risk factors of jaundice. Jaundice most often happens as a result of an underlying disorder that either causes the production of too much bilirubin or prevents the liver from getting rid of it. Okay, it prevents the liver from getting rid of it. Both of these result in bilirubin being deposited in tissues. Okay, both of these result in bilirubin being deposited in tissues. Underlying conditions that may cause jaundice include acute inflammation of the liver, inflammation of bile duct, okay, acute inflammation of the liver, inflammation of the bile duct, obstruction of the bile duct, hemolytic anemia, Gilbert syndrome, cholestasis, okay, these are the underlying conditions that may cause jaundice. Okay, let's coming to the point, acute inflammation of the liver. This may impair the ability of the liver to conjugate and secrete bilirubin, resulting in a buildup. Okay, this may impair ability of the liver to conjugate and secrete bilirubin, resulting in a buildup. Okay, next coming to the point, inflammation of the bile duct. This can prevent the secretion of bile and removal of bilirubin, causing jaundice. Inflammation of bile duct can prevent secretion of bile and removal of bilirubin, causing jaundice. Okay, next coming to the point, obstruction of the bile duct. This prevents the liver from disposing of bilirubin. Okay, this obstruction of bile duct prevents the liver from disposing of bilirubin. Hemolytic anemia. The production of bilirubin increases when large quantities of red blood cells are broken down. Production of bilirubin increases when large quantities of red blood cells are broken down. Next coming to the point, Gilbert syndrome. This is an inherited condition that impairs the ability of enzymes to process the excretion of bile. Okay, this is an inherited condition that impairs the ability of enzymes to process the excretion of bile. Okay, next coming to the point, cholestasis. Cholestasis interrupts the flow. Okay, this cholestasis interrupts the flow of bile from the liver. Okay, bile containing conjugated bilirubin remains in the liver instead of being excreted. Okay, next coming to the point, rarer conditions that may cause jaundice include Crigler-Najjar syndrome, Dubin-Johnson syndrome, pseudo-jaundice. Okay, Crigler-Najjar syndrome means it is an inherited condition that impairs the specific enzyme which is responsible for processing bilirubin. Okay, Crigler-Najjar syndrome is an inherited condition which impairs the specific enzyme responsible for processing bilirubin. Next coming to the point, Dubin-Johnson syndrome. This is an inherited form of chronic jaundice that prevents conjugated bilirubin from being secreted from the cells of the liver. Okay, it is an inherited form of chronic jaundice that prevents conjugated bilirubin from being secreted from the cells of the liver. Okay, pseudo-jaundice. This is a harmless form of jaundice. Yellowing of the skin results from an excess of beta-carotene, not from an excess of bilirubin. Okay, pseudo-jaundice usually arises from eating large quantities of carrot, pumpkin or melon. Okay, Next, coming to the point, treatment. Coming to treatment, medication or supplements can help jaundice depending on the cause. Okay, here treatment will depend on the underlying cause. Jaundice treatment targets the cause rather than the jaundice symptoms. Okay, the following treatments are used: anemia induced jaundice. It may be treated by boosting the amount of iron in the blood by either taking iron supplements or eating more iron rich foods. Okay, iron supplements are available for purchase online. Okay, hepatitis induced jaundice requires antiviral or steroid medications. Okay, doctors can treat obstruction induced jaundice by surgically removing the obstruction. If the jaundice has been caused by use of a medication, treatment for involves changing to an alternative medication. Okay, next coming to the point, prevention. Jaundice is related to liver function. Okay, it is essential that people maintain the health of this vital organ by eating a balanced diet, exercising regularly, and not consuming more than the recommended amounts of alcohol. Okay, symptoms వచ్చేసినప్పటికీ this is the an excess of bilirubin can cause yellow tinge in the eyes. See here, these are the this is the bilirubin structure. Okay, excess of bilirubin can cause the yellow tinge in the eyes and skin. Common symptoms of jaundice include yellow tinge to the skin and whites of the eyes, normally starting at the head and spreading down the body. Okay, pale stools, dark urine, itchiness, మనం common symptoms చెప్పుకున్నాం కదండి, అంతే అవి. Accompanying symptoms of jaundice resulting from low bilirubin levels include fatigue, abdominal pain, weight loss, vomiting, fever, pale stools, dark urine. Okay, next coming to complications. Itching that accompanies jaundice can sometimes be so intense that patients have been known to scratch their skin raw, experience insomnia, or in extreme cases even have thoughts of suicide. Okay, when complications happen, this is usually because of the underlying problem, not the jaundice itself. For example, if an obstructed bile duct leads to jaundice, uncontrolled bleeding may result. Okay, this is because the blockage leads a shortage of vitamins needed for clotting. This is because the blockage leads a shortage of vitamins needing for clotting. Next, coming to types, there are three main types of jaundice: hepatocellular jaundice, hemolytic jaundice, and obstructive jaundice. Coming to hepatocellular jaundice, occurs as a result of liver disease or injury. Hemolytic jaundice occurs as a result of hemolysis or an accelerated breakdown of red blood cells, leading to an increase in production of bilirubin. Okay, leading to an increase in the production of bilirubin. Obstructive jaundice occurs as a result of an obstruction in the bile duct. Okay, this prevents bilirubin from leaving the liver. Okay, this prevents bilirubin from leaving the liver. Okay, this is the overview of jaundice. Okay, thank you.